Hello everyone. Thank you for visiting Learning Concepts for NCLEX. Today I am going to talk about water seal drainage or chest tube drainage. It is called a pleura wake, which is made up of three bottles. The first bottle is called a drainage bottle, which is attached to a chest pleural cavity, and it collects the drainage from the lungs. The second bottle is a water seal bottle which traps air coming from the lungs. And third bottle is a suction control bottle which controls suction inside this system. So let's go ahead and elaborate more on those three bottles. So let's talk about the system. So how this system works. This is a patient's lungs and there is a pleural cavity around the lungs. Anytime the situation comes, whether it's a trauma or it's a surgery, there is a collection of fluid or blood or air around the lungs in a pleural space. Whenever that happens, the lungs won't inflate. So slowly it leads to lung collapse and the patient can die. In order to remove this, we attach a chest tube inside the pleural space so that we can take out the air or drainage from the patient's lungs. In order to do that, we should have a closed system with a suction in that so that we can remove air or drainage. The drainage will collect in a drainage bottle, but the air will go and travel into a water seal bottle where it will get trapped into the water. We usually put a 2 centimeter of water in that, and we will normally see a bubbles coming out from the lung. So you will see bubbles here. These bubbles are not continuous. These bubbles are random. In the starting, we'll see lots of bubbles, and as the bubbles number, as the air will start getting lower, you will see less bubbles. If patient is coughing, sneezing, you might see more bubbles. Anytime you see a continuous amount of bubble in this bottle, like just the same amount and it's continuous, it means there is a break in a system. So we must find the break in system or a leakage in system, or we have to change the whole disposable pleural wake system. The third bottle is called suction control bottle. This bottle controls the amount of suction in the system. The amount of suction pressure depends on the level of water in this bottle. Usually the water level is either 20 centimeter or 22 centimeter. This bottle is attached to a wall suction. The wall suction can be high or low, but the amount of suction in this bottles remains same, which can be either 20 centimeter or 22 centimeter. You will see bubbles in suction bottle. These bubbles are coming because of the suction. When you attach this bottle to the wall suction, you will start seeing the bubble in this bottle. The bubble in water seal bottle is coming from the patient. Okay. Thank you everyone for listening to this topic, and you all take care. I'll see you next time.